So this is about how to speak with legislators. It's primarily about how to speak with legislators on your first visit with them. So if there's one thing I want to say, it's that you guys should feel powerful. Medical students oftentimes feel like, oh, I'm just a student. I don't know as much as the attending. So we feel like you shouldn't be raising your voice. And I'm here to say it's the opposite. When attendings go to speak with legislators, one of the issues that the legislators often have, even if they don't say, is, well, you're in practice. You're looking for ways to make more money. You're going to ask me about malpractice, malpractice. I had one actually put her hand up to her head. I know, doctor, malpractice, malpractice. And I went, no, it's not the topic. Um, so they don't think that about you, right? When you go and talk to them, they're thinking you're idealistic and no conflicts. And when you say you're looking out for your patients, they're not thinking, yeah, but what are you really doing here? They, you have, you have a window while you're a student to be in that persona. And that's a great way to help sort of develop your skills at speaking with them now, before there's that other overlay that sometimes has an impact. So take advantage of it. Do this. Set up meetings, and we'll talk about how to do that. But don't be bashful. Tell them, I'm in your district, assuming that you are, and I'm a medical student in your district, and I thought we could talk about some healthcare issues. We'll talk more about that. But my point here is, don't be bashful. Go ahead and do it. How do you communicate with legislators? The medium is the message, as they say, and the channel really matters. So they range, and this is stuff that I was taught, and this is also stuff that legislative friends of mine have confirmed that this is the spectrum. So the least effective thing to do is to sign your name to one of those gazillion online petitions. So now we have 3,000 or now we have 12,000. I'm not saying don't do it. Of course, do it, because when the people that are presenting the petition go to speak to members of Congress, it makes them more effective when they can say some large seven-figure number of people that have signed it. So sure, go ahead and sign one that you want to, but don't think of that as any more than the 5-second task that it is. I doubt that any of you are running into this, but if you have a reason to fax them, understand it's not going to be effective. Sending it as an attachment to an email, it's extraordinary for a legislator to want to actually open up an attachment. So you want it to be, if you use email for it, you want it to be, a paragraph, maybe 3 sentences that are actually in the text of the email. And you can have a link to, if you want more, but unlikely that most of them will read that. U.S. mail is actually more effective. When they get a piece of mail, that's more effective, especially if you still remember cursor and how to cursive and how to write. A handwritten piece of mail is way more effective than a typed piece of mail. A typed piece of mail, they're not sure how it happened. But if you think about it, I mean, you're taking your pen and you're like impressing on the paper some of your energy, and it reads like that. If you think about letters you've occasionally, assuming that you've gotten one of the last 5 years, gotten from a friend or somebody, that's been handwritten, it's like, oh, I know that they didn't just cut and paste. I know that they actually spent a minute writing this. And the same thing happens with legislators and legislative staff. They know that this is something coming directly from you. And how much does this matter? If it's got an important message, well, maybe you can actually get through. But if nothing else, any of these channels, a petition, a fax, each mails or U.S. mail, any of these get tallied. If there's a hot issue in Congress, the staff will open it and they'll go, oh, pro, oh, con, and they will tell the legislator, hey, we got 30 pieces of mail today in favor of this and only 3 against it. And then you'll hear legislators saying things like that. They'll say things like, you say this is important, bill sponsor, but not a single person in my district has reached out to me. Sometimes they're lying, but all of those outreaches matter. Oh, I have that backwards here. Sorry. Um, okay. Be more familiar with your own slides. Phone call is even more effective. And even if that means that you're leaving a voicemail with the person, again, they be brief, introduce yourself. I am so-and-so. I'm a medical student in your district, and I want to tell you that I support such and such, or I want to tell you that I'm a guest in such and such. That's enough. Don't do a 3-minute statement of all your reasoning because nobody wants to listen to that. But just make clear your point, maybe a sentence more, but even if it's a voicemail, that's great. If you get a live person, again, make that short statement and then say, I'd love to talk about this more with you. Do you have a minute? And try to expand on it. Um, so take advantage of that. But of course, the best is an in-person meeting, and we will spend most of today talking about that. But your in-person meeting might be with the legislator or it might be with their staff. I would say pay attention to their staff. Their staff is really important. Jimmy Hoffa, great management person to model your behaviors off of. Jimmy Hoffa, he once said, "Be careful. The toes you step on today might be connected to the butt you'll want to kiss tomorrow." Very true. He talks about having relationships with people, with workers, and being really good at the one-on-one thing. And then he's like in a conversation with somebody, and somebody else walks up and interrupts them for just a minute. And he makes a point to stop the primary conversation and turn to that new person and go, "Oh, it's so good to see you. Wait a minute," and go back. If you ignore that person, they will think that they have finally seen behind the mask of your caring about them. So never ignore anybody, no matter how disruptive it may feel. And I know I know elected officials whom I first met when they were staffers to other folks. So sometimes staff have these great career trajectories, and the people whom you get to know as a person when they're staff, you can't get a better relationship with an elected official than somebody whom you knew before they were elected. Okay, so what do you do to get ready for the meeting? First is, study up. Be as knowledgeable as you can about the issue, and chances are you wouldn't even want to be going there were you not already pretty good of a subject matter expert relative to 99% of people you're going to talk to. But be sure you've looked into how your legislator has voted. There's nothing more embarrassing than asking for them to support something that they've supported in the past without recognizing that. So if they've supported in the past, say, hey, I know last year you voted for such and such, and that is terrific. And I'm here because I want to just make sure that you don't have any new questions, no new concerns. I want to make sure you're on board. So don't blow off somebody who has voted your way in the past, but acknowledge it. But I've had people who didn't vote for the thing or endorse the thing the third time around because they didn't remember to. Nobody brought it to their attention. They've actually, when I've called them afterwards and said, "Why didn't you co-sponsor this?" They said, "Well, nobody asked me, and frankly, we're so busy, we just got swamped, and it's on the pile of things we're going to deal with. But the vote came up, and we just, sorry." So ask, even your allies, even your staunchest supporters on things that you care about, take a minute and ask them this, do something to make sure that they know and know that what they did. And be sure you know where you're coming from. So what do you do if you're going to speak to somebody and you don't actually agree with the position of the host of your hosting organization? You might want to rethink whether that's the legislative visit you want to make. You're not going to have a lot of time on that visit, and you don't want to spend. And if your host, let's say somebody from PNHP staff or somebody has organized a meeting for you, you really don't want to go into that meeting and explain why it is that you have a different opinion than your group. Maybe on the third visit or the fourth visit when you have a relationship, but make sure you're comfortable in some way representing the position of the host organization if there is one. So know what that is. Then organize yourself. We're going to talk a fair amount about this notion of a message box. It's a tool that is actually used in corporate America, and I'm going to bring it to you, a message box. It's okay to literally have a piece of paper. I often have like a portfolio or something that I'll bring in, and I'll just open it up when I sit down at their desk, and it's got things written for me to remember to hit up, or I'll have an index card that I keep in my pocket because it's so easy to forget, one of your three main points. So it's perfectly legitimate to have that written down, in, not paragraphs, but have a couple words to remind you. I think we all know of somebody running for office who wrote it on their hand. That's probably not a good idea. But it's okay to have notes that you're gonna just keep on track. And actually, that's, if anything, respectful, because it's showing that you have an agenda. It's showing that you respect their time. So don't feel awkward about that. It's a common practice, and it's perfectly legitimate. And it is necessary to rehearse, practice to yourself. We talked a fair amount about this in the past. Do it out loud. Practicing in quiet by thinking it is just not the same as forcing your mouth to form the words. It's just different when you actually speak. So, you know, it's okay to do that. And practice by inviting people over. Have your friends, come over and like we talked about practicing your presentations. Tell them, hey, I'm going to meet with Senator Josh Hawley in 2 weeks. What kind of things do you think he might ask? And can you ask them of me? And let's kind of do a banter about this. So have your friends help you with it the first few times. But the key is practicing staying on message, which is tricky. So that's where the message box comes in. And it's a pretty simple idea. And this idea is if you're going to have a meeting with someone, think, what is the bottom line? Don't have 35 ideas. What is the bottom line? Sign the Medicare for All bill. Sign Jayapal's letter opposing Medicare Advantage, calling for accountability from Medicare Advantage. Whatever it is, clearly tell yourself what that one single message, your goal for the meeting is, and then think of what are the challenges that are likely to emerge, be they on topic or off topic. What are the challenges? And then think of how you're going to get from that answer, from that question, that challenge, how are you going to get back to your topic? So they may ask you something pretty far afield. So if it's likely, kind of plan for it and think, well, if they ask me about this, how am I going to answer that? You don't want to just blow it off. How am I going to answer that and find a way to segue back to my core message? As much of that as you can anticipate, the better. So let's just, as a MacGuffin, use our ask is co-sponsor the bill for Medicare for All. So a common theme, if you're going to more conservative groups, is well, my voters they want to have choice, and Medicare for All is going to take away my choice. Or really, a big government program, we can't possibly afford it. Have you not seen the massive federal debt that we've chosen to ignore and balloon lately? You can't trust government; they can't do things well. Or that's just socialism, you commie pinko. So these are actually perhaps the four most common things I get when I talk to conservatives about this. So think about it and think of what your bridging answer is. I've just sort of made this stuff up, made up my answers, but come up with your own. Freedom of choice. I usually default to they want freedom of choice. Yes, so do I, of doctor and hospital. And then I think I used my little cell phone metaphor last time that we talked or time before. So, that's a good way to answer the freedom of choice thing. We can't afford it. You know, CBO says we can. CBO says we can. The insurance company says that, but they have no evidence. And lots of economists, including the CBO, says, of course we can. And so think of how you're going to get back there. Seniors love their Medicare program. Veterans love the VA. And I happen to believe in the USA and that we can do things better than those other countries that we talked about. So, are you not a strong patriot, Representative so-and-so? Why don't you think the USA can do better than these other countries? Probably don't get that combative, but something about, tap into, if they say that you can't trust the government, well, then tap into patriotism as much as you're comfortable doing. Socialism, I think you've heard me talk a bit about how actually this is a market solution. The market solution today makes doctors compete for insurance products. The market solution under Medicare for All makes doctors compete for patients and not for lucrative insurance products. So, if you're just completely, hate the idea of a market for any circumstance ever, then that's probably not the argument you can make. Try this out. Try this approach to the attack of socialism. Do not go with, they may call you communist, right? And do not try to unpack the difference between socialism and communism. That's like way off topic. If they accuse you of socialism and actually that Medicare for All is not socialism, it doesn't meet the definition at all. Sometimes the answer can be, there is socialized medicine in the world, and that's in the United Kingdom. That's actually in the VA, and that is actually not what we are proposing. So you're right, socialized medicine exists. This is not that at all. We are not pushing for that. And if you are not somebody who believes in socialism, if you're not a member of DSA and you want to, say your point of view, you can say that. But it's really clear that this is not socialized medicine that's currently being in either of the bills. So think about how you're going to get back to your message. Plan to run a show for the meeting. So your best choice is to not meet in their office. Your best choice, especially for state legislators, for feds, it's their windows when they're in district are very small and actually more stressful. But if it's a state legislator, your best windows are in district. Most states are not in session all year round. I think it's Texas that's only in session like every other year. I mean, so they're out of session quite a bit. And they will be more relaxed out of session. And when they're out of session, they're kind of, not getting the juice that they like. They like being the legislator. They like being the elected official. When they're out of session, they're running the paint store. They're not. And so sometimes when you get somebody in district off cycle who's running a paint store, literally, and one person I'm thinking of, and you call them up and want to meet with them, it's like, oh, good. I'm so sick of this paint. Yeah, yeah. Let me go meet. Let's meet. Let's meet. So they like to get back into the role of being a legislator, and they like to be seen, right? They want to get reelected. So they're not going to want to meet with you. They're not going to want to find a place in the state capitol. They're not going to want to meet really at your house unless you even say you'll have a lot of people. They want to be seen. They want to be seen mingling with the riffraff that we represent. So they want to meet at a coffee house or a restaurant or something. And when I first ran into that, I was thinking, well, great. This well-known person is going to be swamped with people, and I'm not going to really get the time that I want. That's not usually how it works, right? They will actually focus primarily on you. And yes, they will pay attention to the Jimmy Hoffa rule. And if somebody interrupts them, they will be nice to that person for 15 seconds. But most of them will then redirect back to you because that is what they wanted to do. So think of this as, I mentioned that every presentation I give, I think of it as a dress rehearsal for the next one. Same thing applies here. Think of your communication with them as building a relationship. You don't have to do all of your rodeos in one visit with them. You're trying to establish yourself as somebody that they want to talk to. You're trying to establish them as somebody who knows what they're talking about. If they ask you a question with an answer that you don't know, you're going to be honest and say, I don't know. That's a really interesting question. I don't know, but give me 48 hours and I'll send you something about that. And then critical, do that. Don't promise something that you're not going to deliver. They will remember that. So that's all what goes into establishing yourself as a subject matter expert and, speak at their level. They won't know any acronyms, use the simplest language that you can. Most of them are really smart and knowledgeable about certain things, and but not this. So it doesn't mean that they're not intelligent. It just means that this is an area that you probably bring much more expertise to. Sometimes you don't. Sometimes you'll find that the person you're talking to actually has, a master's in public health and has like worked 16 years in the industry and knows the stuff way better than you do. And if that's the case, you can have more of a dialogue about, telling me what you think kind of stuff. But establish yourself as a credible person for them to talk to. Establish that you did your homework, and, show that you have passion. So during the meeting, you've seen me use this phrase before, be yourself, sort of. So be yourself, be professional. Show up dressed like a professional. Don't use profane words. Don't be overly casual. Remember that this is theater. This is an act. You need to be, this is not your buddy. You're not going out to coffee with them. Be professional. And yet, make it human. Use the stories in the way that we talked about before. Do not waste their time. Don't tell your life history. Don't say, don't go into some story from 5, 10 years ago that isn't really illustrative of the point you're trying to make. If it's a story that does illuminate what you're trying to make, that's great. But stay on topic. Stay on topic. And think about all the stuff we talked about with pronouns. This is where they're particularly important. Nancy Pelosi kind of makes me cringe every time she does this. She does this a lot. And some legislators, it's like, it's screaming. And I adore Nancy Pelosi. That's not my point. But some legislators, it just screams that somebody trained them to smile all the time. So I'm not saying to do that. I am saying to, think about your, what's it called? Resting bitch face. Think about your face. Think about your facial expression. And if you're just normally sitting there like this when you're thinking about things, well, your friends know that's what you look when you're thinking about things. They don't know that. They don't know that. For all they know, that means that you're angry or so, think about when you're not talking, you know, smile. I'm not saying you have to smile while you're speaking, but when you're in the listening mode, show that you're enjoying being in that relationship and communicating. We all like talking to people who smile more than we like talking to people who frown. So just don't forget to smile on times. We kind of covered some of this. So yeah, okay, good. I'm jumping ahead on myself, so I'll skip that for you. And this is not a social meet setting. This is a very limited time window. And you don't know how much time you have. You know how much time you booked, and it's depending on the setting, it's not unreasonable when you first sit down to say, hey, your staff told me that we have 15 minutes. Do you still have 15 minutes? Or, is there a vote about to happen? Do we have that long or whatever it is? It's okay to ask that question, even though the answer to that question means nothing. So the answer, if you're boring them, they will find a way to get away from you much more quickly. And if they're engaging with you, they'll blow off, 45 minutes or an hour of their time. So you don't know what, the answer is hard to interpret, but try to live within what they say. If they say they have 15 minutes, then you want to think, well, I've really got 5 to make my point and 10 to have dialogue. And that's a good rule of thumb anyway. 5 to make your whole point or less, and 10 for sort of a dialogue. They will often do their best to distract you. You'll come in and they'll be all chummy, chummy and buddy, buddy, and they'll want to start talking about something, neutral and, God, the weather. Oh my goodness, it's so messed, or hey, I was up in your part of town last week, and there's this great fishing spot. There's this restaurant by you. I don't know if you know. And they'll have this conversation. Or how about those Cardinals? They'll have this conversation with you that has, I mean, absolutely nothing to do with your topic. Absolutely. And it feels like, they're just being friendly. You're thinking, this is great. I'm getting to be friends with this person. How powerful is that to be their friend? That's not what's going on. They're burning through your time. And this is a deliberate, thoughtful, proactive scheme that some legislators use. Burn through the time. And then, it's, oh my God, there's a vote coming up. God, we talked all about that. We never even got to what you brought up, so tell me, you can say it. Oh, okay, thanks. I got to go. Sorry. And you just completely have nothing left. So if they start to do that gambit, 2 things. First, recognize it. Oh, 3 things. 2, don't fall for it. But 3, be polite. So, don't cut off, oh, I don't follow sports, which is sort of my answer on sports because I don't. But, go, yeah, it's pretty amazing. But, I know your time is short, Congressman. Can we get back, can I get, I know your time, and you can say that, when they bring up some adjacent topic, you can say, I would love to talk about climate change with you. I would love to have that conversation, but, I know your time is short and I'm like here on a mission, laugh at yourself. I'm on a mission, and we've got to get to this thing. So, can we come back to that? So feel free to assertively, switch back to your topic. Don't get sucked in there. And they will not be offended in general, even though they might want to act like that. They won't be. They will recognize and respect that you saw the game and you played it with deference and with respect, but you saw the game and you didn't fall for it. And then the other one that eats up time is oh, hey, there's Bob, my photographer. Hey, you want a picture, don't you? You want a picture of us together, right? I really want to get that because I want to keep, so hey, Bob, come on over and get our picture. And then, Bob's good. And then, hey, Bob, can you use their iPhone? And they hand you their iPhone. And then, Bob says, oh, shoot, the pictures didn't come out. And then you've got, let's try it again. Come on. Oh, let's go over by this thing. And before you know it, you've spent 5 minutes on a photo and you've only got 10. Then you've spent forever on the photo. So if the photographer is actually right there, it's harder to get out of, but say, okay, but I would love that too, but can we keep this really brief because I know your time is short. If it's not that the photographer there is there, if it's just that the legislator is saying, let's do it, well, then say, can you're going to disappear almost any minute. I know you've got such a busy day. If there's time at the end, can we do that? So try not to even get into that, of course. And the worst option is don't bring it up yourself. At the end of the meeting when business is concluded, sure, it's great to have that photo, but be careful, a time-eating photo op monster. Weaponize your data. Data is data. And actually, in my corporate life, we used this phrase. Oh, that's good data. How can we weaponize it? Numbers need faces and feelings. We talked about the four quadrants of how people think. So numbers by themselves might be all you need for some people, but most people need other things. They need humanity connected to those numbers. So find a way to bring the data to life and show why you care. Be selective about which set of numbers you use. I can promise you, pharma is great about this. You know, something that goes from 1% to 1.5%, they can describe as this is 50% better than that other thing, you know, or 50% more danger, but so relative risk, absolute risk, uh, pick the number that is correct, accurate, don't lie, but be selective. You know, why not be selective? So here's examples. And this was actually something I stole from pharma when we had this kind of a discussion. I'll spare you which drug, but look at that chart. They look the same, don't they? Look at this chart. Old drug versus new drug. Well, my golly, the new drug is way better. Look, there's even like a p-value on there, you know. So what's different on that? There's a lot of things different left to right. They're both accurate, right? They're both accurate, same exact numbers. So one thing is font sizes. So on the left, you're trying to make it look ineffective. So there's these big fonts with that, and on the right, it just looks more like data. The right looks more like sciencey data on it. It's got numbers on the charts and stuff. You know, there's actually a p-value. There's decimal places. It looks really sciencey. So think of whether that's something you want or don't want. P-values, you know, I mean, 99.99% of the people that you will talk to they can't spell P value. So it means it's got no meaning. And so it sort of clutters up the slide. Maybe that's good. Makes it look sciencey. Maybe that's good. But unless you're actually using this for a scientific analysis, just be thoughtful about whether or not you're going to do that. And look at the grid lines, right? The one on the right, the grid line is 1/4% apart. And you can fiddle with that in PowerPoint or in Excel. The one on the left, the grid lines are 25% apart. Grid lines emphasize the difference between the old drug and new drug. Without grid lines, so it just makes it look like more of a difference. It emphasizes the distance. So if your goal is to emphasize the distance between these two things, grid lines are great. That's, kind of talked about the axes. And my habit is to try to make the scale disappear in the top. The one that I want to make look big, it kind of busts through the top. And there's tricks to do that in PowerPoint if you want to. So weaponize your data, manage your time, watch for the pivot. You'll be having this conversation, and then one time that comes to mind is then they say, well, you're right. I mean, the insurance industry is getting a lot of profit off of this, and I'm not sure what the value is. I guess that's a pretty valid point, but what's really where money is really being wasted? It's the end of life care. I had somebody say this, that we spend 80% of our money on the last 6 months of somebody's life, and they die anyway. Why are we doing that? And a lot of this, I'm being told, is just futile. It doesn't actually help. If we want to focus on something, we should focus on end of life care and make that more humane and make that less wasteful and keep them in their home and all these wonderful things you can say about end of life care. And you know what? If you're not expecting it, that's a topic you might really care about. And you'll wake up and go, yeah, yeah. And you'll chime in on the conversation and you'll have ideas and they'll have ideas. And there won't be a bill pending in Congress to deal with it. There won't be a bill pending in Congress to deal with it. That's why they picked that topic. You have no idea what they really think about it, but they picked a topic that you can both get revved up about and for which there is no action you're going to request and there's no accountability on whether they acted in alignment with what you said and what they said. So watch for that. Watch for the pivot specifically to an inflammatory topic. And that's why I said it's hard to stay on message. They're not going to pivot to the best flavor of ice cream. They're going to pivot to something you care about that's going to distract you. So remember why you're there. Remember that the time clock is moving quickly and stay on message. And then remember, none of this is what it seems. None of this is what it seems. So I'm pointedly aware of 3 meetings I had in the last 3 months with Senator Josh Hawley's staff, and I'm still not over how angry I am about this, where it was really unbelievably clear that he was not going to vote for the big better bill if it does anything to hurt Medicaid. I couldn't have gotten that any more clear from the staff of three different meetings. I even went in with with nuns on one of the meetings. I mean, we were like, he lied to the nuns, he lied to the nuns. So, it doesn't. So sometimes the agreement means nothing, or sometimes the opposite means nothing. Sometimes they will have adopted a position and they will hear you and they no, very few people in the middle of an argument go, "You're right. I'm a Baptist now. Oh, what's wrong with me? Why didn't I realize that?" That doesn't happen. That doesn't happen. Maybe it does. I don't know. But I've had plenty of conversations with people that adopted very conservative positions when we were talking, who then came back to me a month later and it landed. Nowhere during the conversation did it look like it landed. The whole conversation, I thought I got nowhere. But then a month later, the vote went the way I was hoping. So, that's cool. And it's probably not that my conversation landed. It's probably that I was one of 20 people who descended on them. So you don't know what the whole soup is that's leaning towards them. But my point is, don't be overly encouraged, and don't be overly discouraged. Do your best, and but remember that their positions very well may shift. At the end of the meeting, ask for something. Have a specific ask. Um, and sometimes tell them the ask right at the beginning because a lot of these folks are so busy that if you don't have an ask, if they don't know you're going to have an ask, a request, a specific behavior you want, if they don't know that, when they know that you're going to have an ask, they're more willing to pay attention to you and stay focused. And you can maybe, depending on the story arc, you can maybe say, so I'm going to ask you for such and such. If that's a really polarizing ask, maybe don't open with revealing what your ask is. Open with saying, there is something specific we're going to talk about that I'm going to want your vote on. So we're going to get to that in just a minute, but let's talk about sort of why I think this and let's get there. So let them know that there's going to be an ask, and then don't forget to make the ask. So, and the ask should be specific. This is a line that Don Berwick, I don't know if you know his name, Institute of Healthcare Improvement, former head of CMS, amazing human being from whom I've learned a lot. And he was working on a project that his son, I think he said, came up with this line because they were just saying, we're going to save some lives before too long. And his son said this, some is not a number, soon is not a date. So his general campaign to improve outcomes in hospitals became, no, we're going to save 100,000 lives in the next 18 months. Um, I think that was the number that he had. But, have a specific, if there's try to be as specific in your request as you can be. Ask, if you want them to co-sponsor, overtly say, so are you willing to co-sponsor this bill? And they may respond with, well, I haven't really read it in detail. This is my first exposure to it. And say, okay, well, I know you have access to it. I'll email you the link to it just to make sure. And I'm going to check back with you in a week. Is it okay if I check back with you in a week to make sure that, you don't have any questions that I can help you with? But specifically ask if they're going to co-sponsor. And if they say yes, you don't want to rush right out, go on to TikTok or something and say, that you got a yes out of so and so. You don't want to do that unless they tell you that you can quote them. So if they say yes, ask them, is it okay for me to quote you? They may not be comfortable with that just yet, so don't overplay it. They can even backpedal the ask. Say, I know you may not want to do this, but I just want to know, is it okay if I quote you? So find a gentle way. But if you're thinking of quoting them, don't quote them. Don't quote them from your private meeting unless they've given you permission. And then, yeah, do is try to loop back if you have more questions. And don't bring in a library. Bring in one, leave behind, as we said. Immediate view. We talked about this, I guess, in the other talk. So with legislators, if you really want to be persuasive, use big fonts. We talked about fonts in PowerPoint slides. Same thing for these folks. Don't try to pack things in by using a 10-point font. Use a large enough font so they don't have to think, I got to read that. Don't do that. Don't turn them into Chuck Schumer doing it. Don't do that to them. So large fonts, pictures are helpful. A nice handout has white space on the paper. Number one is less intimidating, and number two gives them place to scribble and take notes. So, make it paper that you can write on. Don't use photo paper. Use paper you can actually write on, but nice paper. So, do that. And again, as we said before, embed your contact information and use your business cards. After the meeting, shut the hell up until you're in a private space. Shut up until you're in a private space. You don't know who's around you. You don't know that the security guard in the elevator can hear what you're saying. You don't know who just came out of the bathroom. You have no idea who's around you, who can hear you down at the end of the hall. You don't know who's near you. So act as if you're on in front of a hot mic. Act as if you're in front of a hot mic. Because let me tell you, information is power, knowledge is power. And if somebody hears you say, yeah, can you believe that jerk? Or, man, such and such. If somebody hears you say something, that's knowledge and power. Hey, they'll run back to the office and they'll tell the legislator, I don't know who you just met with, but you need to know what they said on their way out of the office, because then that gives them power. That makes them stronger with the person. So my point is, don't talk about this stuff in the stairwell. Don't, if you're going in with more than one person, or you're on the phone. Don't talk about it in the hallways. Don't talk about it in the stairwell. Don't talk about it in the elevator. I'm telling you, elevators are not private. Wait until you're off campus or in your own car or your host's car. So really be careful about that. Take notes because you'll forget half the stuff. So jot down notes for yourself. And then if you have a team, you should all get together and kind of share notes. You don't want to send tickets to a sporting event, but unless you're pharma, I guess. But hand write a note to the legislator saying thank you for their time, and maybe you can write a separate note to their staff. I confess I seldom do this. I usually email a thank you, but a handwritten note is nice. It's nice to do. And if it's okay to talk about them on social media, say, hey, I had this great meeting with so and so's staff, and even though we don't all agree, it was really a good conversation, and I appreciate that. So show that. And then try to keep things going. If you promised that you would send something, send it. And then make it be overt about the fact, hey, I'm a medical student, I know about lots of other things, So if you have something where you want my opinion, I'm here for you, and I'm eager to be, sort of your back shop on some of this stuff. You don't have time to look into all these things. And maybe tell that to the staff. You don't have time to look into all these things. If you want somebody to research, blah, blah, if it's close enough to the stuff I'm interested in, ask me, if I can help you, I'll try to. If you agree to that, then you have to actually do that work. Last thing is that if you get your bill passed, that's just the beginning of the game. It turns out that laws have two phases. They have the legislation, but then almost all pieces of legislation go to the regulators, who then write all the rules. I mean, almost every piece of legislation, I think the ACA had hundreds of references for the Secretary of HHS to put language around such and such. And indeed, the Medicare for All bills have language where stuff has to get built out. So that's where the game really becomes alive, is on the regulatory process. So stay track to that. And the story that really drove this home to me was from our PNHP's past president, Carol Paris, good friend of mine. And her first engagement with legislative action was that she's a psychiatrist, and she was getting, I hope I was going to say this exactly right. I might not represent it perfectly, but she was seeing that she was getting a lot of patients from a particular insurance company, and a lot more than she would have thought. And she asked them, why? Some of the patients, how do you pick me? And they said, well, you're the only one in network. So Carol went online and saw that the directory for that insurance company had all sorts of other psychiatrists in her geography listed as being a network. So Carol called them, and to a T, they all said, no, I don't take that. I'm not taking patients with that. So Carol got a law passed in her state to require network accuracy from insurance companies. She actually did all the work to get network accuracy be statutorily required, and then went home, went back to work, went back to seeing patients. And it didn't solve the problem, because what she didn't know was that the insurance industry went into the regulatory process and got the penalty for violating that law. The penalty for inaccurate directories was set to zero, to zero. So that's where the game often really happens. Fight to get the right legislation, but then don't forget that the regulatory process is non-trivial, and deal with that. So I think that leaves us 1 or 2 minutes before I have to go run off. Any thoughts, questions? Rihanna, you're up first.
Hi, thank you, Dr. Weisbart. I was just wondering, I haven't ever spoken to like a legislator in person. I've like called on the phone and like written emails, but like if I did want to set up a meeting, like what's my um way to get the foot in the door, essentially?
It's actually easier than you might think. It's the same thing you've already done. You call up the legislator staff, whoever answers the phone, say, hey, I'm a med student, in district, and I'd like to get some time to. I'm going to be in your area, off and on the next few weeks. Make it sound like it's just coincidentally easy if you want to, and I was hoping we could find some time to get together. The staff usually have more flexibility on their time than the elected official does. So you could even suggest, open with that, because it sounds more it sounds more fortuitous. Say, hey, I'm going to be in district. I'm going to be in the capital on Tuesday next week. Do you have any time on Tuesday that that I could meet with you? And if they say no, I'm really busy, then go, oh well, when are you? When could we? So the person that answers the phone, and then they may say, well, I'm not the scheduler, and go, oh, well, who is the scheduler? I'll ask for them when I call back. So just ask for it. And don't be bashful about saying you're a med student in district. Don't be bashful about that. That really helps. I didn't realize how much that helped until recently when I said, I mean, because whenever I call one of these people, I can usually get in, and I didn't realize that that's because I played the doctor card. So play that card. Use your power for good. And Anna, was it? Oh wait, Ariana, was that what you were asking? Good. And Anna,
Um, yeah, so when you were talking about building a message box and coming up with possible arguments and your counter arguments to it, I found myself doing that before. And then what happens is I come up with so many arguments against my point that I get discouraged or I just find myself, I keep digging myself into this hole. And then I'm like, oh, I really don't know enough, or maybe I shouldn't be arguing this. How do you make sure you don't get there? Like you want to be prepared, you want to be able to have something to say against every argument, but you don't want to discourage
yeah.
yourself.
I would say that's a really healthy phase to be in, because, I mean, just to be honest, maybe we're wrong, right? Maybe Medicare for All is actually a really stupid idea. I mean, I don't think so. But, maybe we're wrong, or maybe this really actually doesn't make sense to you. And as much as PNHP has invested in you being, good advocates going forward in the future, you got to be your own person, And if you believe in something different and some of the arguments are compelling to you, follow that. Don't follow the evidence, follow the data, don't follow the ideology. So, I mean, there are a couple of positions that I have that are not aligned perfectly with PNHPs, for example, and I'm going to talk about one of them in a week or two with you. So, that's fine. If you have a completely different point of view, which mine is not, if you have a completely different point of view, well, then kind of pay attention to that, and think, does that really not what you think, and chase it down. If your point of view is adjacent, which is how I kind of view mine, it's more tactical than philosophical. Then I have this point of view, but I'll giving a spiel, I'll talk about, here's the stuff, and then I may pause and say, but that's now I want to put on a different hat, tell you kind of what I think, which is a little bit different. So you can do that. But I'd say don't let yourself get too overwhelmed and overloaded with all the arguments against. I wasn't saying to pick out the top 100 arguments. Pick of think of three or four. Think of three or four. And if then during the meeting the legislator brings up something that you hadn't anticipated, um, it's really healthy to have the reaction that you're having of, huh, that's I hadn't thought that piece through. Let me think that piece through. You're making a very good point, Representative. Let me think about that some more, and can we talk about this again, or something. So I'd say just be honest. Are there arguments against, a single payer? Of course there are. And I've done as deep a dive into as many of them as I come upon, and invariably I wind up coming back home. But you don't have to. Follow your heart. Do what you think makes sense. And speaking of following things, I need to get going. And I think you do too. You've got your next one's still not till 2, right? So you got a few minutes or 3 your time. Or zero your time. I don't know. I gotta go. We'll see you again before too much longer.